My name is Marina Ibrahim, and today I will be talking about the effect of COVID-19 and flattening the disease curve. To begin with, the coronavirus disease 2019 or COVID-19 is a respiratory illness that can spread from person to person. The virus that triggered COVID-19 is an original coronavirus that was first recognized during an examination into an outbreak in Wuhan, China. COVID-19 is spreading from person to person throughout the globe as well as in parts of the United States. The risk of infection with COVID-19 is much higher for people who are at close contact of someone known to have COVID-19. The first case of COVID-19 in the United States was reported on January 21st, 2020. Currently, the number of cases are increasing drastically throughout the world and especially in the United States. Here is the current numbers of COVID-19 people who are infected as the total cases in the world, which is about 3,600,000 cases. In the United States, it's about 1,200,000 cases, as well as the total death rates. It's about 251 cases, and in the US, it's about 69,000 cases. As you can see, the numbers are pretty high in the world and especially in the United States. So according to the Centers for Disease Control and Prevention, COVID-19 is caused by a coronavirus. Coronaviruses are a large family of viruses that are common in people and many different species of animals, including camels, cattle, cats, and bats. Rarely, animal coronaviruses can infect people and then spread among people, such as with MERS-CoV, SARS-CoV, and now with this new virus, which is named SARS-CoV-2. So COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. So patients with COVID-19 have had mild to severe respiratory illness with symptoms of fever, dry cough, and shortness of breath. These symptoms may appear about 2 to 14 days after exposure. Severe symptoms include pneumonia in both lungs, organ failure, and in some cases, death. People can help protect themselves from respiratory illness with everyday precautionary methods, such as avoiding close contact with people who are sick. Also, avoid touching eyes, nose, and mouth with unwashed hands. Washing the hands often with soap and water for at least 20 seconds, and to use an alcohol-based hand sanitizer that contains at least 60% alcohol if no soap and water are not available. So the significance of this problem and disease to the world is great. Airports are shutting down, countries are closing their borders, travelers are placed in isolated quarantine, schools and universities have gone online, countless people are unemployed, stocks are affected, healthcare workers are being overworked, and the list can go on. Handshakes and hugs are now considered a high-risk act. In addition, religious holidays such as Easter, Passover, and Ramadan are simply celebrated at home. Likewise, graduation, commencements, and ceremonies are canceled or postponed. On Thursday, April 23, 2020, Governor J.B. Pritzker announced that he plans to extend the stay-at-home deadline, until May 30th, 2020. This means that the state of Illinois is still in the process of flattening the curve. In order to help this situation, people are required to stay at home as much as possible in order to avoid social contact. Some of the exceptions for this order include if an individual is an essential worker, such as healthcare workers or grocery store workers. Another exception is if people are simply going for a walk around the neighborhood. However, they still should be practicing social distancing. The significance of this problem greatly impacted my internship site. At first, the hospital as well as my internship site were practicing extensive cleaning practices and being very careful and cautious in all of our actions. On Monday, March 16th, we received information stating that the screening program will be suspended until April 6, 2020. However, on Tuesday, March 23rd, 2020, I received an email that the screening program will be suspended until May of 2020. As a result of COVID-19, my internship site was suspended. This also means that for the hospital, all non-emergency surgeries are postponed until further notice. This practice is also adopted by most hospitals across the nation in order to prevent the spread of COVID-19 and to ensure the safety of the patients as well as the healthcare workers. The government recommends multiple things. The main government recommendation is social distancing in order to flatten the curve. This includes people staying home in order to stay safe and at home. Similarly, contact between individuals should have at least 6 feet of distancing. It is also recommended that individuals should properly wear face masks in public, avoid touching their face, and to properly wash their hands and or use hand sanitizers. Likewise, many healthcare facilities are now using telehealth to connect with patients. Many individuals are utilizing the app Zoom to connect through schools, universities, and religious affiliations. Bars are currently shut down, restaurants operate through pickup and or delivery, and all non-essential businesses are closed. Also, travel is restricted. But for my personal recommendation, I believe the government should have taken action right from the start. As a result, it would have prevented more people from getting infected and more people from dying. The government should also implement a curfew in order to further reduce contact between individuals. For example, from 6 p.m. until 6 a.m., all individuals are required to stay home. However, the exception goes for healthcare workers and emergency responders, such as police officers, firefighters, etc. Another suggestion that I would like to make is to work more together. I believe if all the states work together and if the countries around the world truly work together, we will develop medications as well as vaccines for this disease faster. However, it seems to me that the world is dispersed, and that is not what community health teaches us, because community health teaches us to work in groups and to incorporate all members of the community. And in my opinion, if all members of the world are equally, fairly, and justly incorporated in a program to help develop medications and vaccines for COVID-19, then I believe the diverse experiences and education will develop medications and vaccines faster than if each country is simply working by itself. In conclusion, the COVID-19 pandemic has greatly affected the entire world. In order to help flatten the curve, it is important to practice social distancing as well as to take measures such as wearing a mask, washing your hands, using hand sanitizer, and deep cleaning touched objects. It is also important to work as a community, as a city, as a state, as a nation, and as a world to fight this pandemic and to learn from it. In doing so, we will be able to take preventive measures and actions to reduce the risk of another worldwide pandemic happening in the future. Thank you so much.